Dengue has become a major international public health concern in the recent years. In Singapore, our tropical climate makes it a favorable breeding condition for the Aedes mosquito that leads to dengue. What are the warning signs of having dengue? When should you visit a doctor? And how do you prevent yourself from becoming a victim? We asked Dr. Michael Lee to give us the answers.
Dengue is an infection and is caused by a virus. This is transmitted through mosquito bites. And it's not just any mosquito, but the female Aedes aegypti species. There are to date 4 different strains or types of dengue viruses. Here's the good news. Recovering from one strain accords you lifelong immunity against that particular strain. The bad news, it's only against that strain. Therefore, it is still possible to get a second or even third episode of dengue infection from the other strains. Studies have shown that these subsequent infections may increase the risk of developing severe forms of dengue that may lead to death. Dengue presents with fever with 2 or more of the following symptoms: headaches, eye pain, muscle aches, joint pains, abdominal discomfort, nausea or vomiting, and rash. The rash may present as generalized red patches, generalized flushing, and/or red patches with whitened borders. The symptoms last anywhere between 2 to 7 days after an incubation period of 5 to 10 days. Immediate medical attention must be sought with severe symptoms. They can present as persistent fever, sweating with cold, clammy hands and feet, dizziness, near fainting and rapid heart rate, severe abdominal pain, persistent vomiting, no passing of urine for 4 to 6 hours. There may be signs of bleeding, namely nosebleeds, bleeding gums after brushing of teeth, vomiting of blood, sticky black stools, or bloody diarrhea. Given the signs and symptoms mentioned earlier, it is dengue until proven otherwise. Even when symptoms are mild or vague, there is a high index of suspicion with just fever and muscle aches for more than 48 hours. Your family doctor or GP will then perform blood tests to confirm the diagnosis, assess the severity and risk of complications. Here are some general advice for the prevention of dengue. 1. For you and your neighbors to make a concerted effort not to create breeding grounds for mosquitoes as outlined by the National Environment Agency. 2. Wear bright colored clothing when outdoors. 3. Use insect repellents to cover exposed skin. And 4. Avoid going out at dawn and dusk, as these are the periods when mosquitoes tend to feed. Last but not least, prevention is always better than cure.